Tonight's second story, which is our final one, is called Mr. and Little Miss Hospital, read by the same artists. I know I read this one before. This is 2025's version, I think. Yep, here we go. Mr. Bump had learned a lot of things in his life. To never set foot on a skateboard, to never climb ladders, and to never bounce on a trampoline. But yesterday morning, he made a mistake and banged his head and had to go to hospital in an ambulance. The ambulance driver was Little Miss Quick, so they got to the hospital before he could say, "Quick sticks!" Which was nearly as fast as the porter, who rushed him into accident and emergency on a stretcher. The porter was Mr. Rush. "Hello, Mr. Bump," said Dr. Happy. Everyone at the hospital knew Mr. Bump. Being the accidental fellow he was there nearly every day. Dr. Happy checked him over, and then Nurse Naughty bandaged him up. Bandages on bandages. The next person to arrive at hospital was Mr. Silly. Dr. Happy could not believe his eyes. He had never seen a case like Mr. Silly's. "How on earth did that happen?" he asked. But it was probably best not to ask. There were many reasons why people ended up at hospital. Mr. Tall had hurt his leg and needed an x-ray to look at the bones. However, with Mr. Impossible as the doctor, he didn't have to go to the x-ray room. Dr. Impossible had x-ray vision. Mr. Tall had broken his leg and it needed to be set in plaster. An awful lot of plaster. Poor Mr. Tall had to walk with crutches. Ever but extraordinarily long crutches. There were lots of different machines in the hospital. Mr. Nobody had to have a scan, but the doctor could not believe his eyes when he looked at the screen. There was nothing inside Mr. Nobody. Not a thing. "That's impossible!" cried Dr. Impossible. Some people had impossibly difficult illnesses to diagnose, like Miss Giggles, who was admitted with a rather peculiar problem. She kept making very odd noises, like this. A tish, hick, giggle up two. A tish, hick, giggle up two. All the doctors came to see her and they all went away scratching their heads. Whatever was wrong with Miss Giggles? It took all of Dr. Brainy's brain power to work out that Miss Giggles had the case of the hiccups with the fit of the giggles on top of the flu. Some people were at hospital to have an operation. Before an operation, the operating room had to be germ-free, and the perfect person for that job was Miss Neat. It was the cleanest, shiniest, neatest operating room in the world. I don't think Mr. Messy could get a job in a hospital. The patient was given an anesthetic to put them to sleep before this operation. Unless the patient was Mr. Lazy, he was already fast asleep. The operation was then performed by a surgeon who must have a very steady hand. I don't think Mr. Jelly would make a good surgeon, and definitely not Mr. Tickle. While the patients were getting better, they stayed in a hospital ward where the nurses looked after them. Everything Nurse Perfect did was, of course, perfect. And you would think that Miss Helpful would also make a wonderful nurse, but as helpful as Nurse Helpful tried to be, things never quite went to plan. The head nurse on the ward was Little Miss Bossy. Matron Bossy. She didn't manage the ward. She also made sure the patients behaved themselves, especially patients like Miss Trouble. Nurse Hug worked in the maternity ward where babies were born. She was very good at soothing all the babies. While the patients were recuperating, they were allowed to have visitors, which was something to look forward to. Unless the visitor was Miss Chatbox. Chat, 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 chat. Miss Sunshine was very glad that the hospital had visiting hours. Otherwise, she might have been up all night. Mr. Greedy had bought in some grapes for Mr. Quiet when he went to visit him, which was very thoughtful, except for the fact that Mr. Quiet didn't get to eat any. I wonder why. When it was time to leave hospital, some of the patients were wheeled to the exit in a wheelchair, like Mr. Quiet and Miss Sunshine when they were all better. However, they were wheeled out by Nurse Naughty and Mr. Mischief the porter, who had a wheelchair race down the corridor. Matron Bossy was not happy. As Miss Sunshine and Mr. Quiet were leaving, Miss Quick arrived in her ambulance with the sirens blaring. And who do you think she was bringing to hospital? Somebody who had an accident. And who could that be? That's right, Mr. Bump. Back again? Said Dr. Happy. Now in this story there are some did you know facts. There are lots of different jobs in a hospital. Many people work together to look after you when you are unwell, and they all play an important role in your treatment and recovery. Nurses like Nurse Perfect and Nurse Hug managed most of the ongoing care and treatment in hospital. They have years of training to help you get better. Florence Nightingale is probably the world's most famous nurse. She was known as the Lady of the Lamp because she would visit soldiers at night to make sure they were okay. She changed nursing into a skilled and respected medical profession. Sometimes when you get sick, all you need to do is sleep and drink plenty of fluids. Other times you need to see a doctor like Dr. Brainy. A doctor is a bit like a detective who will ask you some questions about your symptoms and examine you to diagnose your illness and work out how to treat it. Doctors have many different roles in a hospital, and Dr. Impossible is an orthopedic surgeon who is especially trained to deal with things like broken bones. Time for our top 10.